I specialize in pulmonary medicine. Some of the more common things that we see, and I enjoy seeing, is COPD, asthma. I really like seeing patients for dyspnea, just short of breath, not sure why. It's really great to be able to come up with an answer for people and get them started on the right track. I like to think that I'm very thorough, and I really I find that almost always we can come up with a diagnosis, or at least tailor our diagnosis based on the patient's story. So I really try to take the time to listen, and I love to hear all those little details that you think might be important, because they can often be overlooked. But it's great to be able to come up with a unifying diagnosis for many of the symptoms that you're having. Growing up, I always read Sherlock Holmes and other mysteries, and it was awesome to solve the puzzle. In medicine, every patient is a bit of a puzzle. Everybody's different, everybody presents differently. The thing that I love is, figuring out what is causing the patient's symptoms. Even when I don't come up with a diagnosis right away, it's one of those things that you're constantly thinking about that patient. You're constantly searching literature for an answer. And when you do finally come up with a diagnosis, it's like, I'm just so excited to tell the patient that we figured out what's wrong with them. We may not always have an answer, but I think there is an answer on how to fix the problem. But at least I think there is much comfort in it, at least knowing and putting a label on something. That's one of the biggest rewards for me. My name is Joe Pitcher. I'm a pulmonologist here at Spectrum Health Medical Group.